You're watching the American Health Journal, the show that brings you the latest information on prevention, diagnosis, treatment, and research from doctors throughout the United States. Watch the American Health Journal each week on this public television station.
World-renowned Norwegian researcher Dr. Boyne Eskeland, widely recognized as the world's foremost expert on young tissue extract and egg research, also called Fibroblast Growth Factor, or FGF, as an important nutrient in cell regeneration.
Oh, we have so many studies through the years, because this is like 20 years now. I have been mainly working on product based on fertilized chicken eggs, and we have studied in psychiatry, we have studies in memory loss, we have studied in sport nutrition, and all those studies, they also report that they find some other positive effect regarding their lifetime quality aspect.
One of the key things in normal aging is that we have a problem with our collagen breaking down. We lose the elasticity, we lose the normal padding that comes from good fibroblast function, good collagen growth, and with that normal aging process. So when we're able to use something like Fibroblast Growth Factor, FGF, to stimulate the growth of fibroblasts, to stimulate the relaying down of collagen, this is the framework within our joints, within our skin, all those areas of our body that need that additional support, which we lose with natural aging. So FGF actually stimulates our body's ability to repair that natural structure within our joints and within our skin.
FGF plays an important role in hormones by reducing cortisol and increasing serotonin.
Cortisol is a stress hormone. The benefit of reducing the cortisol level affect many of the quality of life aspect, especially the quality of sleep. You wake up more relaxed, and you also realize that you get a better energy level. Your mood become better. You feel not as much confused. People with high level of cortisol, they may forget things very easily. Serotonin is an hormone that increases the quality of sleep. So when the cortisol level reduces, the level of serotonin increases. And actually it has a positive, good effect in diabetic patient. They don't often need as much insulin for the daily supply, and so it is regulating the blood sugar level. The first studies we did were actually on the pure product from fertilized chicken eggs, but later on we found that by adding like shark cartilage, pea protein, the efficacy of the product improved.
When we return, we'll learn about the importance of supplementing our diet with important nutrients that aren't often found in standard multivitamins. We'll hear from the doctors about a clinical research study on a unique blend of natural ingredients to support the circulatory system.
Join the American Health Journal on Facebook. Search for American Health Journal.
I'm a chiropractic doctor, but also a clinical nutritionist. And I've done clinical nutrition for almost 50 years now, so supplementation is very, very important for folks, and I've had the opportunity to actually teach and lecture that around the world.
One of the important things as physicians that we realize is that it's hard to get patients to take pills. If you give someone a handful of pills to take, chances are they won't take it. So the more we can simplify their supplement regime so that you combine a lot of these medicines into one pill, the better these patients do. The more likely they're going to take those things that are going to help them have better health and better longevity.
The advantage of taking omega-3 supplement is then sometimes it's paired with other products that can also help your system. There are, for example, omega-3 products that can have CoQ10 or vitamin K2 that's mixed in with the omega-3, and now all of a sudden you're getting several benefits just besides the omega-3 by taking that pill.
The ingredients of Laminine omega-3 plus are the following: omega-3, omega-6, omega-9, coenzyme Q10, and vitamin K2, and the fertilized avian egg extract.
The benefits of the Laminine omega-3 plus are so vast in the circulatory problems because so many folks in our culture experience circulatory problems that can be affected by heart disease, artery disease, diabetes, and these have vast implications of problems.
Life Farm Global recently completed a clinical study on Laminine omega-3 plus to try to find out if combining omegas, coenzyme Q10, K2, and FGF had any effect on blood pressure or cholesterol and could potentially assist in circulatory system repair.
We are doing a study on Laminine omega-3 plus, testing for high blood pressure and cholesterol.
I elected to be part of this study because it gave me an alternative to taking allopathic medication. I knew my cholesterol was starting to creep up, and as you know, there is some history of heart issues in my family.
I was suffering from high blood pressure. I've had that problem for a long time, probably 5-6 years. I don't know why. I wasn't really overweight, a little belly fat and things like that, but really nothing more than that. And it just baffled my doctors, and it baffled my holistic health care practitioner.
We were out to find out whether or not it would really help the cholesterol and lower the bad cholesterol, increase the good cholesterol, and lower the total cholesterol, and lower the triglycerides. It was a placebo-controlled, double-blind study.
It really excited me because I do have a blood pressure issue. The last 3 years it's been kind of climbing, and I just refuse to use drugs because I'm totally want nutritional ways. And my blood pressure when I started was right around 140 over 100, and now, happy to say, after just 4 weeks, it was 134 over 88.
The preliminary results show the following. Number one, that the total cholesterol is decreased. Number two, that the good cholesterol, HDL, has increased. Number three, the LDL, the bad cholesterol, decreased. And number four, the triglycerides, which is the fat in your blood, also decreased. And number five, that the blood pressure in the participants went down to normal.
It was like almost immediately all of that brain fog lifted and was gone. So the mental clarity and the ability just to focus again was just amazing. I would say on an average, my blood pressure is probably like, 120, maybe 115 over about 80.
You're watching the American Health Journal, the show that brings you the latest information on prevention, diagnosis, treatment, and research from doctors throughout the United States. Watch the American Health Journal each week on this public television station.
Good circulatory health and providing proper nutritional support is not only important for adults. Physicians and parents are discovering that for many children, not having the right balance of nutrients could be the root cause of behavioral and learning problems.
Even with the autism now, they're starting to show that there's some aspect to that, one component potentially.
My son was struggling very hard at school. And it got to the point where our teacher approached us and she asked if we could basically put him on medication. She said he needs to be evaluated from a doctor because he must have ADHD or something. And so that just didn't sit well with me. I knew he was struggling with attention and focus. And so we wanted to reach out and find something that felt good for our family, that felt like a good solution for him.
My daughter brought me to Laminine omega-3 plus. When she was in the first grade, we found out she had a rare conductive hearing loss. And when they finally got that fixed and got hearing aids on her, she had to relearn vocabulary things sounded different to her. Well, the school said that after about 9 months after getting the hearing aids, that she was having a thing called sensory overload. I needed to take her to a doctor. So I took her to some doctors, and they just said, well, yep, she's dealing with a lot of medical issues. Definitely retention and comprehension is is her struggle, which is a lot with a lot of kids. We can put her on like a Ritalin. And I said, well, she's not hyperactive. This doesn't quite make sense. She could comprehend but could not remember. Something was not right in the brain.
So before I gave him any type of medication, I did consult with a physician, showed him the product with the ingredient list, which was very short, and he said there's nothing in here that could harm my son.
This product is a whole food product, and it is, unless you have allergies to eggs, really there's no side effects.
So when I went to doctors, I looked for a doctor that could have a conversation with me. I wanted to know with that combination, is that optimal? I wanted to know if I needed to add anything else. And we had this real conversation about how, on a cellular level, how it would affect my daughter. And he said, bottom line, this was like the optimal set of ingredients for the brain.
Can adding nutrients, including omegas, make a difference in learning and focus for children?
Our teacher reached out and she said, what are you giving him? Thank you for trying something. I'm not sure what you're doing, but he's a completely different kid. I am seeing changes already. And she said, it's not the typical changes that I see with kids that go and get medicated from the doctor. But she said, he is himself. She's like, he is singing again in classroom. He's interacting with the kids. And he's remembering where his assignments are. And he's remembering to turn in his assignments.
And all of a sudden, she was progressing a little bit. And then a little bit more. And then a lot more. And she's not just an average student. She's above grade level student. And this was a little girl who everybody told us would not progress, would not retain half her information that she would ever learn in her life.
In normal health and wellness, so often we focus on prescription medications as if this is the answer to helping us with our heart and our general cardiovascular health. In reality, science hasn't caught up to all the benefits of supplementations and other different chemicals that naturally occur in nature. So supplements are more whole.
The correct blend of natural ingredients in a supplement may have a beneficial effect on your circulatory system and general health. Remember, before discontinuing any prescription medication, consult your physician. Thank you for watching the American Health Journal. We wish to thank the experts and medical professionals for their participation in making this program possible. And to view previous shows, go to our website, thedoctorshow.com. As always, we will continue to keep you current on the latest and best in medicine for your better health. For the American Health Journal, I'm Chris Long.